Anderson here from A Healing Place Complete Counseling Care, Neenah, Wisconsin. You're going to see a couple of my little friends in the background. Behind my shoulder there is Shenzi. She's actually our therapy dog that comes to the office. I don't know if you can see my other little guy. He's right down here. That is Woofy, and he's sitting on the bed, and you're going to see Amos kind of walking in and out of here. So you'll see some dogs coming in and out, and I apologize for that, but they're a little bored. Today I'm going to talk about attention deficit hyperactivity disorder, ADHD, and the effects of it and treatment for it for children. May is Mental Health Awareness Month, and since ADHD is a pretty prevalent disorder for children, it seemed like the best one to choose. Plus, it's something I get asked a lot about as a clinician. So statistically, it's estimated that 6.1 million or 9.4% of the population of children have ADHD from the CDC in 2016. And so it's interesting how that breaks down, because typically boys are more likely to be diagnosed with ADHD than girls. And the age that you'll see, the biggest age area that kids get diagnosed to between ages 6 and 11, which makes sense because that's when they're in school and that's when these behaviors or this disorder will have more of a prevalence versus at home or when they're younger, maybe in daycare. And so when you're thinking about ADHD, it's important to understand a few things about them. First of all, there's oftentimes a second comorbidity diagnosis with it. It could be anxiety, depression, conduct disorder, oppositional defiance disorder, autism, and Tourette's. Oftentimes it could be a possible another diagnosis along with ADHD. So it's really important that you get a thorough neuropsych testing to get diagnosed with this. I get a little concerned when people go into their pediatrician, spend about 5 minutes explaining symptoms, and the diagnosis from the pediatrician is ADHD. They really should be going to a psychologist who is a child psychologist who's going to do the appropriate testing to make sure that they actually do have ADHD. Is there any other kind of comorbidity diagnosis with that, and really making a good determination, because this is a diagnosis that does oftentimes require medication, and you want to make sure that you're not medicating children unnecessarily. So I always recommend to my clients that they really get neuropsych testing before making a decision about ADHD. The other thing about ADHD is what research shows that 6 and above really should be on medication and having behavioral therapy. Those two things together are going to really help for the best prognosis. Under age 6, they really feel like they could probably start with behavioral health therapy first, see if they can get the behaviors under control before they get into school, so that they can figure out a natural way to maintain their symptoms of ADHD. Now, for some children that is possible. For other children that would not be possible. They would struggle with trying to do that. So don't assume just because I made that statement that all kids can be without medication. Some just would not be able to do that due to the severity of their ADHD. So let's talk about the symptoms of ADHD, because that's another question I get asked a lot. So there's 3 pieces that you're really looking for when you're looking for ADHD. The first one is there needs to be inattention. They can't keep focused. And we're not talking like, everyone occasionally gets bored and looks away. These are children who really can't stay focused. At their age level, they should be able to stay focused longer than they are. Obviously, a 3-year-old's focus is going to be a lot less than a 8-year-old's focus. But an 8-year-old should be able to sit for an amount of time as the average 8-year-old and stay focused. And if you're finding that your child can't do that, that could be one indicator. A second indicator that you're looking for, especially with ADHD, is hyperactivity, meaning this child can't sit still, is always on the go, maybe on the move, touching this, touching that, walking around the office. I can tell immediately when I have a kid with ADHD in my office, because they cannot keep their hands off of anything. They can't sit still real long. They're interrupting often, because they have the third part of this is that they're impulsive. They make impulsive decisions. They are maybe a little bit risk takers because of their impulsive decisions. They interrupt people. They're the first one that put their hand up, but instead of waiting to be called on, will blurt out the answer. They tend to talk a lot. There's just a lot of activity with this, and they can really struggle with delayed gratification. So that's what you're looking for when you're looking for ADHD. So again, people oftentimes can lack focus, it can sometimes be hyper, and sometimes can have inattention, but that doesn't necessarily mean you have ADHD. You really want to be paying attention to what's severe about this and how often does this happen, and it's much more than the typical person. So inattention is things like misses details, makes some careless mistakes in schoolwork, doesn't even turn schoolwork in because they forgot that they were supposed to have the assignment, or they forgot they did the assignment. Can't pay attention in play, or can't pay attention in lectures, that are not following through on things, don't get their homework completed, or they start a project and they walk off and start another project. So you're really seeing a lot of inattention with that. Again, that hyperactivity, impulsivity, fidgets in their seats, can't stop talking, unable to play and engage in things that they like to do, interrupts others constantly, was oftentimes running around or dashing around or can't sit still. You know, again, this is also about the age level. So a 3-year-old is not going to be able to sit still as long as an 8-year-old. You do need to take into account the age level. But if you're looking at an average 3-year-old, is this average 3-year-old more inattentive and more hyper than the typical average 3-year-old? So you really want to take those into place when you're talking about ADHD. So the things that create ADHD certainly are genes. This is a genetic diagnosis. There's a very likelihood that one of the parents, if not both the parents, might have ADHD. You also are looking at that low birth weights and brain injuries certainly have been factored into some of this. So ADHD is, like I said, is more common in males than females. And when we're talking about that treatment and that therapy, again, you're looking for medication and you're also looking for behavioral health therapy. What the medication does, it's stimulants. And what those stimulants do is that they actually seem to have an unusual effect on people with ADHD, that it slows them down. I don't have ADHD, so if I would take a stimulant, I start talking like this, I'd be very excited, I'd be very hyper, and I would be feeling very raced, because it would actually engage and stimulate my body. With children who have ADHD, however, it has the opposite effect and slows them down. And so because of that, they actually are able to increase those brain chemicals, dopamine and norepinephrine, struggling to say that, which plays a role in thinking and attention. The other thing that you want to make sure is that you're always doing these under medical supervision, because they are controlled substances. So you do want to make sure that you are giving them the right effective dosage and that it's appropriate. If a dosage gets too high, we can see an actual stimulation of more irritation and aggression. One of the things that I see, and with ADHD, with specifically males, but I see it also in females, is there does seem to be more irritability or anger. And I suspect that's just frustrated that they're consistently getting in trouble, that they feel like they can't do anything right, so they feel frustrated. So, you know, a lot of times parents are very hesitant to put kids on medications, but what I would need a parent understand is that child is actually suffering. They're suffering because of that decision. So don't let the fear of medication keep you away from a potential treatment that will help your child. And again, you want to really make sure that you get a thorough neuropsych testing. And then there's also certainly some different techniques as far as behavioral modification that can work in helping with children with ADHD, which is why therapists comes in very handy with that. You also might want to have them tested when you're doing the neuropsych testing for any kind of learning disabilities, because again, that could also be an issue with ADHD, is that there's learning disabilities. So there's a lot of complexity to this particular diagnosis, and it's not that easy just to look at a kid and say, yep, ADHD, which is why I highly recommend neuropsych testing. I could and have diagnosed somebody with ADHD when it's just so very clear between the grades at school, between the reports from parents and teachers, between what I observe in my office and listening to, I get a full history and make a decision about that. And I can't, as a therapist, at least in Wisconsin, I can't prescribe medications, so I would need to send them to their doctor anyways. But I 9 out of 10 times require and request that they go get tested. I don't want to make that decision without appropriate testing that shows or confirms what my diagnosis is. So if you haven't been able to get testing, you're looking for someone who's a child psychologist, and you're looking for someone who knows about neurotesting for ADHD. I hope these tips help you. I know it can be scary when you think your child might have a diagnosis, but think of it like any other health diagnosis. You want to find out about what it is, get it diagnosed correctly, and find the right treatment, and your child will be fine. Children who get the help they need younger tend to be much more successful through school and tend to be much more successful in adult world. So please don't let the fear of ADHD stop you from getting help.